I hope everybody is safe and well out there. It's just been an extraordinary, unimaginable time. And it's been so great that we have this big tent that we all work, are part of, this community around the country, and how we all support each other through a variety of ways. And one of the ways we're going to support you today is some information that we think will help the agencies that we support and that are so important now. This is the kind of help that we really need, most at this time. So I'm very pleased to host that. We're hosting it in conjunction with the National Council for Behavioral Health. They're longtime colleagues and good friends, and a great source of information and advocacy and support. The idea for this really came from our Chief Operating Officer, Len Statham. And he is going to be the moderator for this event. And then you'll hear from Len, and then Jessica, who Len will introduce, and then Rebecca. And I'll stick around to make sure everything goes right. Not really, but I'll stick around. So, Len, it's up to you.
Thank you, Harvey. I really am thrilled about this particular webinar, because we have heard many things regarding some problems that people are having accessing the number of programs that are out there to help organizations get through this, at least financially, get through the virus and all the social distancing we're doing. And so we've got two really good speakers that I'm excited about, and we're going to hear from them in just a minute. Eileen, can you go to the next slide, please?
I just want to point out. I just want to point out, we're getting a note that the audio is a bit low.
Okay.
Talk louder, or maybe we'll see.
I did want to point out that we are offering another webinar next Thursday at noon, and it's what CARES economic stimulus payments offer SSA recipients. There's been a lot of confusion around how the stimulus payments affect and impact SSA recipients. And so we have a webinar to address those concerns. And so we'll hopefully have a number of you joining us again next week as we begin this next part of this webinar series. Next slide. So I want to introduce today's speakers. They're top-notch. First, we have Rebecca Farley-David, and Rebecca is a senior advisor at the National Council for Behavioral Health, which I'm sure many of you know. She's been empowering and advocating to make voices heard in Washington, D.C. We all need that representation. She supports providers and consumers in advancing public policies that strengthen access to care, leveraging data and communities' experiences to tell the story of our nation's health and addiction safety net. And she has up-to-date information, up-to-the-minute information about the CARES Act. We also have Jessica Johnson from DeLea Accounting. And Jessica is really going to be talking specifically about the Paycheck Protection Program and helping people to sort of really give concrete advice about how that process unfolds. Some people have been running into difficulties. So Jessica is going to walk people the kinds of things that they need, the documents that they're going to have, the banks that are participating. So she's really getting into the detail. And she has 17 years experience in fund administration. She's provided financial accounting services to clients as senior management, and she's with DeLea now, and she's also working with us. So we're thrilled to have her on as well. So I'd like to turn the program over to Rebecca Farley-David, and Rebecca will be first, and then we'll go and we'll be speaking with Jessica. So next slide, Rebecca.
Thank you, Len, and thank you, Harvey, and thanks to the whole team for inviting us to be part of this webinar with you. At the National Council, for any of you who are not familiar with us, we are the national organization representing community-based providers of mental health and addiction services around the country. Our functioning really exists in coordination and collaboration with state associations like NYAPRS, and you know, we're so thrilled to be collaborating with you on this webinar today. As Harvey said, we know that so many of you are in dire straits right now while also doing your utmost to respond to this pandemic. And so I'm hoping that the information I'm able to share will be helpful to you in understanding what kinds of financial support are out there, both in the sense of what funding is available now and what we know about those funding streams, as well as what will be coming down the pike where we may not have full details yet, but you should be aware of those future potential opportunities. We will be saving questions to the end, I think, but do feel free to enter them in the question and answer box on your control panel. I'm sure there's going to be many questions, so my goal is to not talk too much up front and save time for that discussion at the end. Next slide, please. All right, so there has been a lot of congressional and regulatory activity in response to the coronavirus. I don't think I have ever in my career in DC seen so much legislating in such short order in response to a catalyst of any kind. You can see here that Congress has already, during the course of March, enacted 3 massive spending bills designed to pump money into the economy and bolster the healthcare system. We're going to primarily be focusing on the CARES Act, which was the most recent one. That is the legislation that had the most in it in terms of direct support for providers and community organizations. We are hearing that there is a 4th relief package in the works. We don't have a lot of details yet about what that will look like, but certainly where there are gaps in the current response to the crisis, we're hopeful that the 4th coronavirus package will fill some of those gaps and provide additional funding and additional support. At the same time that Congress has been acting to appropriate funds and shore up our healthcare system, the administrative agencies are also taking regulatory action to do the same. CMS, the Centers for Medicare and Medicaid Services, has made a number of changes designed to expand access to telehealth. We're also seeing funds becoming available for purchase of equipment to support telehealth, and then some other regulatory changes to open up access to care, including medications. So I'm going to go over as much of the current activity as time allows, and then again, we'll have plenty of time for questions. Next slide, please. Okay, so let's start by diving into some of the key provisions in the CARES Act for behavioral health providers as employers. So obviously, provider organizations are businesses, just like any other business, and in dire need of support. And so there's a few sources of funding for organizations. One is the Small Business Administration Economic Injury Disaster Loans Program. This is a program that has existed for a very long time. It provides loans to organizations affected by, by disasters, natural disasters, and so on. Eligibility for these loans has been expanded under the terms of the CARE Act. So at this point, eligibility is open to all organizations of under 500 employees. Now, obviously, that does not cover the full scope of organizations across the country that are in need of support. It really is designed to focus on small businesses, but we are hopeful that larger organizations will see some additional relief coming soon. The loans available under the EIDL program provide up to $2 million to affected small businesses in designated disaster areas, which right now is the whole country. country. There is an application to apply for the EIDL directly from the Small Business Administration. National Council links to that application on our website. So you'll see on the screen a link to the National Council resource page for COVID-19 response. We had so much up, so many links, so much information. It was not possible to put it all in one slide deck. So I just want you to know that those all the resources, all the links that I'm going to refer to are up on our website and accessible at any time. We're updating that website on a daily basis. So please don't hesitate to check back often and see when more information becomes available. So as I mentioned, the EIDL loans are up to $2 million. But I think most importantly for the pandemic response, the CARES Act allows organizations to receive a $10,000 emergency advance on their grant. I'm sorry, on their loan. EIDL is a loan program. And the CARES Act allowed for a $10,000 advance on that loan, with the advance not having to be repaid. So the $10,000 advance is essentially like a grant. You don't have to repay it even if it were later to be determined that you were not eligible for the loan. So those emergency $10,000 advances are supposed to be available within 3 days of your application. And again, the larger amount of the loan is up to $2 million. And these are low interest loans. All right, in addition, there is the Paycheck Protection Program. The Paycheck Protection Program is a brand new program designed to help employers keep employees on payroll during the course of the public health emergency. So these are government-backed loans. In many cases, they can be forgivable. They are meant to cover about 8 weeks of payroll, rent, mortgage payments, utilities. The loans can be forgiven if you maintain your workforce. And Jessica is going to have a lot more details about the Paycheck Protection Program and how that works for behavioral health providers. So I'm not going to say too much more about the Paycheck Protection Program right now, but please do feel free to send your questions into the Q&A box, and we'll definitely get to those. Additionally, there are various tax incentives available through the CARES Act, again, designed to help employers maintain payroll and continue functioning during the public health emergency. So I'll highlight a couple of them, which are the Employee Retention Tax Credit and then the option to defer payroll taxes. Please note that if your organization is accepting a loan through the Paycheck Protection Program or through the Economic Injury Disaster Loan Program, you wouldn't be able to claim the Employee Retention Tax Credit. So some of these are an either or type situation, and you're definitely going to want to consult your finance people or legal team to determine what the best options are for you here. So the Employee Retention Tax Credit is pretty much exactly what it sounds like, a tax credit available to employers for maintaining it's a refundable payroll tax credit that's equal to 50% of wages. So that's a maximum of $10,000 in wages per employee, which can be actually paid to employees during the crisis. So this credit is restricted to employers who are experiencing either a full or partial suspension of operations and who see revenues decline by more than 50% relative to the same quarter in the previous year. So there's a lot of details here about what goes into this tax credit. Again, we have a full analysis of all of these employer-related provisions up on our website. So please do check our website for our FAQ and our analysis for more details. The delay of payroll taxes allows employers to defer payment on the employer contribution of payroll taxes through the end of the year. So half of the deferred amount, and then there's sort of a staggered rollout for when the payroll taxes are due. So half of the deferred amount would be paid at the end of 2021 and the other half by the end of 2022. Okay, and again, please check out our website for additional details and analysis on all of this. Next slide, please. Okay, So then there is some financial support that is flowing directly to states and directly to behavioral health providers to assist with response to the coronavirus pandemic, and to help keep these entities solvent while they are experiencing loss of revenues due to decreased patient encounters. So I think the biggest pot of money available right now is the HHS Provider Relief Fund. That was a $100 billion fund appropriated by the CARES Act. And the fund, although I think it was widely described in the media as being a fund to support hospitals, HHS has been very clear that other organizations are also eligible to receive the funding. And in fact, an initial allocation of $30 billion has already gone out to Medicare billing providers with the amount of that payment based on their Medicare fee-for-service billing in 2019. That means that there is $70 billion remaining in the fund. And so HHS is trying to figure out ways to provide fast turnaround, targeted distributions to other types of providers who may not have a substantial share of Medicare billing. So they're looking at how to get this money out to Medicaid providers, how to get it out to rural areas, and places that have been especially hard hit by the pandemic, more so than others. So we're still awaiting guidance and information on how that remaining 70 billion will be distributed. But do know that Medicaid providers are among the top priorities for HHS in the disbursement of those funds. Additionally, there was a $425 million allocation to SAMHSA again, for supporting states and providers with coronavirus response. The SAMHSA funds, 110 billion have already been, 110 million. Oh my goodness, it's not often in the behavioral health world that you are in a situation where you can mix up the billions and millions, because it's not often that we get billions of dollars allocated to anything. So excuse me, 110 million of the 425 has been announced already by SAMHSA that it will go to states to support states with their response. Now, I think the expectation is that states are going to use this to support their healthcare system's response to the coronavirus, their behavioral healthcare system's response to the coronavirus. And so you will be seeing funds flowing from your state as a result of that $110 billion allocation of funds. We just don't have all the details yet on how the money is going to flow from states to providers. That leaves $315 million in that SAMHSA account that is earmarked specifically for providers of behavioral health services. So again, you see some money flowing through states and then some money flowing directly to providers. We don't have details yet on how that remaining $315 million is going to be allocated, but it's one of those items that we will absolutely be tracking and we'll let people know as soon as we know more. In addition, in the CARES Act, there was an extension and expansion of the Certified Community Behavioral Health Clinic program. There are 8 states, including New York, that are currently participating in that Medicaid demonstration designed to expand access to comprehensive outpatient mental health and addiction services. As a result of the CARES Act, that existing demonstration program has been extended through November 30th of this year. And there have been 2 new states added to that program. This is a program that was quite popular. 19 states applied to participate, but only 8 could be selected due to a statutory limitation on the number of participants. That statutory limitation has now been somewhat lifted, and 2 more states will be able to join the program. We don't know what states those are yet, but SAMHSA has 6 months to announce which ones they will be. With the CCBHC demonstration come a lot of opportunities to expand care access, particularly in ways that do not require face-to-face contact. And it includes an emphasis on crisis intervention and support, which is especially important at a time when emergency departments and hospital beds are needed to to respond to coronavirus, right? We don't want folks that could be kept out of EDs and hospitals to be admitted because we need those beds for people with the coronavirus. So the CCBHC program has dedicates funding to to help with that crisis support, to help keep people out of hospitals and emergency departments, and to support interventions like telehealth, the purchase of technology and so on. So there's a lot of real benefits there to participating organizations, including organizations that partner with CCBHCs to ensure access to services for the folks they serve. So more details to come on what that expansion will look like in the 2 new states, but for now in the existing 8, they will be able to continue CCBHC operations through November 30th. There was also a 6.2% increase to the federal matching, the federal medical assistance percentage. That's the federal match rate for Medicaid services. I think that's important in the sense that it provides additional federal funding to states for Medicaid services. So that 6.2% bump will really help your state as we're seeing, decreased revenues and so on. And hopefully, of course, those funds will flow through to behavioral health providers for support of your operations. Next slide, please. All right, we're seeing a lot of regulatory changes at both the federal and state level as well. In the context of Medicare, CMS has acted quite quickly to remove a whole bunch of restrictions on telehealth that advocates have been pushing for many, many years. I'll provide just a quick summary of a few of the top changes. There's a much longer description of these changes up on our COVID-19 website. But a few of the changes under Medicare are that telehealth is now permitted in homes. So patients do not have to go into a clinic in order to access telehealth services. They can stay home. There are new billing codes that you can now bill as telehealth encounters in Medicare, and new providers that are able to bill those codes for telehealth services, including psychologists and social workers who previously may not have been able to do so. There are some changes to the direct supervision requirement in Medicare. This is relevant because there are certain provider types who cannot bill Medicare directly for their services, but have to bill incident to services provided by a physician when those services are provided under direct supervision by the physician. And so previously, direct supervision meant that you had to be, the providing clinician had to be in the same physical location as the supervising physician. CMS is now saying that audio-video connection to the supervising physician can take the place of that direct supervision requirement. So that is potentially opening up Medicare incident to billing quite a lot, and one of the important changes that Medicare has released. Medicare has also begun to indicate that it will cover certain audio-only interactions, knowing that access to smartphones is a challenge for many people. Medicare has announced that certain types of encounters can be billed if they are as telehealth encounters, if they are audio only without a video component. Now, this is not, they did not open that up very wide. It's primarily evaluation and management codes that can be billed as audio-only interactions. We're still pushing to get other behavioral health codes like psychotherapy and so on included as audio-only billable encounters. CMS is aware of this issue and has indicated that they may be issuing additional future guidance on this. We don't know yet what that future guidance might look like or when it might come. Additionally, CMS has announced really state Medicaid programs have the ultimate authority over what gets billed as a telehealth visit in Medicaid. CMS has essentially issued a clarification saying, yes, state Medicaid programs, you have this authority. You have it within you to say that any encounters can be billed as a telehealth encounter, including audio-only encounters. And so, to the extent that that you need additional flexibility there on the Medicaid side, I would definitely be reaching out to your state about that, as they're the ultimate arbiters. We're also seeing some movement from the Drug Enforcement Administration to open up the prescription of controlled substances via telemedicine. In order to crack down on illegal online pharmacies, DEA has long had a number of restrictions in place that have made it somewhat difficult for controlled substances like stimulants or buprenorphine to be prescribed by telemedicine. And so DEA is now somewhat loosening those restrictions. And again, we have full details about what that looks like on our COVID-19 website. Finally, knowing that the infrastructure in many places is lacking to support telehealth, the Federal Communications Commission has opened a grant application portal for grants to support the purchase of telehealth equipment. So the link to that portal is also up on our website, along with additional details about how to apply. And we certainly encourage organizations that do not already have access to equipment that supports telehealth to consider applying for one of those grants. So this is a brief overview of many of the changes we have seen on both the legislative and regulatory side over the last month. Again, please, if you have additional questions, please put them in the Q&A box, and I think we'll come back to them at the end.
Actually, Rebecca, I'm going to step in here because we're getting quite a number of questions, and I'm just going to have you answer a couple of them. So,
sure.
People that have asked questions about PPP will save for after Jessica's presentation, because she's probably going to answer a number of them. But the first one is CNN is reporting that the Small Business Association is running out of money. What does that mean for entities that have already been approved, as well as new applicants?
So yeah, I've been reading several headlines that the SBA has been struggling to keep up with the demand. So a couple things. We have every reason to believe that in the next coronavirus package, additional funding will probably be allocated to the Small Business Administration to support these loans. You know, nothing is for sure in Congress until it passes, but I know that Congress is aware of this and considering whether they can funnel more money into that program. For organizations that have already received the loan, it shouldn't be a problem. I have heard that they are struggling to process the $10,000 advances within the 3-day window due to staffing shortages. But hopefully they will be able to streamline those processes and expedite the issuance of those $10,000 advances.
I wanted to just jump in real quick just to talk about that $10,000 advance. They just made a change to it, and now they're limiting the amount for $1,000 per employee that's currently active. So they're not going to just do a standard $10,000 anymore, just $1,000 per employee.
Thanks, Jessica.
Yeah, things are changing day to day, Rebecca.
Day to day, absolutely.
Right. Also, another question comes, is everyone getting the 6% increase for Medicaid during this time?
So I just want to be clear that that's not a 6% increase to provider reimbursement rates. That is a 6% increase in the share of Medicaid expenses that the federal government will cover. So what that means is, you know, if $100,000 was billed to Medicaid, now the federal government will be covering 6% more of that. And the state will be covering 6% less. So it's financing and a financing arrangement between the states and the feds. With the additional funding flowing into the state, it is certainly our hope that states will use that money to support providers. But the FMAP increase is not, unfortunately, a direct bump to provider reimbursement rates.
Gotcha. Another question, are the EIDL loans taxable?
I am not a tax attorney, so I have to admit I don't know the answer to that question. Let me check our resources up on our site and see if we have that answer. I'll get it to you, Len, and we can get it out to everyone.
Sure, thank you. Finally, can you touch on the county-owned Article 31s in New York, which are clinics here in New York State, that aren't covered under the SBA provisions since they're taxpayer funded?
That's another one I'll have to look into and get back to you on. Yeah, one thing we're finding in the course of all of this is that our team, which has historically been focused on healthcare policy, is quickly having to get up to speed on many areas of employment and tax law that we had never addressed before. So I'm sorry I don't have the answer to that one off the top of my head, but I will look into that and see what information I can get you.
Okay, and how is small business defined?
For the purpose of the emergent economic injury disaster loans, small business is defined as any organization, including nonprofits, that has under 500 employees.
And another question here, early in discussion on what was in the CARES Act, it was indicated that there was $300 million specifically earmarked for CCBHCs. Was it determined this was not the case and they're part of the group of providers that may receive some remaining $315 million allocated to SAMHSA?
Yeah, so of that $315 million remaining, there are some earmarks in there. So $50 million is earmarked for suicide prevention programs. $250 million is allocated to, $250 million was put into the CCBHC line item of the SAMHSA budget. That being said, it was congressional, and they did that because, you know, this is one of the only lines in the SAMHSA budget where funding flows directly to providers. A lot of SAMHSA money goes to states. And so they put the money into that line item with the intent by Congress that it would be distributed to providers beyond the group of CCBHCs, but to behavioral health providers, you know, across the country. So we don't have guidance yet from SAMHSA on how they intend to put that money out. But the funds you're referring to are the $250 million earmarked for the CCBHC line item in the SAMHSA budget. And that is part of that larger $425 million allocation that I mentioned.
Okay. Another question, the amount for the FCC telehealth program seems small and being awarded sort of on the rolling basis. Is there a sense that behavioral health is a priority here?
I have not read anything from CCBHC, or from FCC to indicate whether they have priorities among the different groups of eligible applicants. I would definitely encourage you to apply early because it is being awarded on a rolling basis. It's the kind of thing that, you know, hopefully we would see more money put into this program as part of the fourth coronavirus package.
Rebecca, is there a sense that the next CARES Act will include additional support for that particular allocation?
I hope it will. We're also, one of the things National Council is working on right now is a $38.5 billion request for behavioral health providers to respond to the pandemic. So I think it's become pretty apparent that the $100 billion that was initially allocated in the CARES Act is far from sufficient to address the needs across the country. We feel strongly there is a need to funnel money directly to behavioral health providers. And so we're asking for $38.5 billion more dollars specifically for organizations that offer services for mental health and addiction.
Great. All right, we have a lot of questions related to PPP, so I'm going to turn it over to Jessica now. And Jessica, if you want to cover the PPP program, and then we can get back to questions because we still have a number remaining.
Okay, sounds good. Okay, so I'm going to talk about all of the, I included a lot of facts in regards to the PPP program and the process and how we can calculate it and what the banks are requiring. I will just mention right now, there are a lot of banks that have paused the application process online because the volume that they received along with the funding, banks are really just processing what they have currently and will hopefully, if Congress passes the fourth bill, be able to open up the platform again. So depending on your bank, and it really varies bank to bank. Next slide. So just to go over what the PPP program, they authorized $349 billion for small businesses to be able to pay their employees during the crisis. So the purpose too behind this loan is to have people remain on payroll with their current employer and not go on unemployment. So this was a very popular loan for small businesses throughout the US. So it really, the banks got, I think, overwhelmed when it opened up back on April 3rd. So I would recommend anyone that is interested in this to contact their bank ASAP to see if they're still able to accept applications. So this loan will be forgiven as long as you use it for the following. So like I mentioned, is to keep your employees on payroll. So it's geared to cover 8 weeks of your payroll. So the calculation that is used is your average monthly payroll multiplied by 2.5%. So that's going to give you 8 weeks of payroll, and then about 25% to cover your mortgage, your interest, any rent expense, utilities over that 8-week period. So that also is saying that you're going to maintain your current employees and not drop more than about 25% of your current staff. When calculating the 2.5 months of payroll, for employees that are making over $100,000, they have a cap on that for an annualized basis. So you could only use the first $100,000 for an employee when putting together your calculation. I do want to mention one thing for nonprofits. This is not to reduce the amount of your grants. You still want to utilize the grant first, and anything above and beyond that that's not covered through the grant, any admin salaries, for instance, you're able to use it for that. So you still want to utilize your grant first. If at the end of the 8-week term and you haven't used all of the funding that you received, you are able to pay it back with no penalty and or keep it as a loan at a 1% interest rate. So like I mentioned, it started on April 3rd. It is really to a point where some banks are closing down the online application. They opened it up on April 10th to independent contractors and self-employed individuals that are also eligible for it to be able to cover their own payroll. Next slide, please. So there are several banks that are SBA lenders that you can, reach out to your local bank. We've processed a little over 50 applications for our clients and utilized several local banks such as Pioneer, Citizens, KeyBank, Berkshire, M&T, SEFCU, Bank of America, Trustco, and Champlain Bank. So if there is a list of banks through the SBA lender website, if you want to check that, or reach out to your local bank if you have a relationship with them. So all businesses can apply, including nonprofits. It is geared, like I said, for businesses with 500 or less employees that can apply for the program. And in order to submit the application, you're going to have several documents that you're going to need to gather in advance of the application. Even though it's running, it said till the end of June, I would do it as quickly as you can. Next slide, please. So just from experience, we went through many applications, like I mentioned, with different banks, and it does vary bank to bank. Just some of the consistent documents that you will need is copies of all 4 quarters of your 941s and or 940. A lot of banks are looking just at 2019 when we're putting this calculation together, although some banks will allow your Q2 2019 through Q1 of 2020 wages as well. So again, check with your bank. The current year payroll registers through the period of February 15th. They want to be able to see what your current payroll, what your current staff look like. We put together a loan calculation worksheet that's going to take all the information from our 941s, including With payroll costs, you can include your employee benefits, so medical, dental, vision, and any kind of employer 401k or 403b match. You can include that as well in your payroll calculation. So a lot of banks will want to see your worksheet. And some banks will want to see an applicant ownership form that they'll provide you. On some of the applications, if it is nonprofit, we ran into a snag with, you know, who do you put on there as the owner? So there's many members of the board, the executive director. So they said you are able to use one member from the board, an officer, and put their personal information in there for 100% ownership for just for the purpose of the loan application. So that was one thing we had questions on with our local banks. Next slide, please. So the program is open, like I said, till June 30th. Apply as quickly as you can. You are only able to take out one loan for this program, although you are able to take both the EIDL and the PPP loan if you wanted to. The up to $10,000 per employee, I think we talked about, you get $1,000 per employee, which caps at 10. If you do apply for the EIDL, it does roll into the PPP loan as well. So what you can use your loan for, obviously it covers payroll, including your benefits, the interest on your mortgage expense as well. If you've had that through February 15th, any rent expense, any utilities that were in service before February 15th. So just as an overview, we talked about capping your employees at 100,000 when doing your calculation. You can include also employee benefits for vacation, family, medical, or sick leave. State and local taxes are also included. So your state unemployment tax, it does not include any of the FICA taxes. So that you would not include. We referenced on the 941, we used line 5C for the gross wages. So you don't want to include any type of FICA taxes on there. Next slide, please. So what are the next steps? So everyone is asking right now, a lot of our clients are asking us about the forgiveness process. So we are waiting on further guidance from the SBA. Things are changing day to day. So the information I know of right now is as of today. So how much of the loan will be forgiven? If you use all of the loan for what it was intended for, it covered all of your payroll, you were able to use it for your mortgage and utilities and such, it should all be forgiven. If because of the calculation in your employees that maybe you had in 2019 started, you know, at a certain point of the year or terminated at a certain point of the year, but it was included in your calculation, if you don't use it all, you are able to pay it back with no penalty, and or keep on your books as a loan at the 1% interest. So they are going to ask for various documents to support the usage of your loan. So I would be prepared to include all of your payroll registers for the 8-week period that you get it. So it starts when you actually get the money. It doesn't start, you know, at the beginning of April when the loan got rolled out. So it will start at the date you get the loan. And then I'm sure you'll have to provide any kind of invoices or supporting documents that you have for the payments for rent and utilities. So again, that more information will follow on the forgiveness process. So I would be able to provide more information as we know more over the next few weeks. Next slide. All right. So again, this is just more information. All the payments, the interest on your loan are all deferred for 6 months. However, interest will continue to accrue over that period. If you do keep the remaining monies that is not forgiven, you do have 2 years to pay it back at that 1%. No prepayment penalties. No collateral is required, so you're not guaranteeing it. There's no personal guarantee And just a part of the application, you're really just certifying it in good faith that you're going to use it for the purpose of what it's outlined for. All right. Next slide. I think that covers all of, you know, the information I have around the PPP loan. I know the online, I will just share with all of the banks that we've used, the online portals have been very easy and straightforward to apply online if your banks still have that option open. Just be prepared ahead of time to have all your documents ready, have your calculations done, and then the banks, if they do need further information, they've been emailing us and asking via email. So there hasn't been, you know, too much phone interaction or follow-up outside of just some emails from them.
Thank you, Jessica. Rebecca, you want to join us on the screen? We've got a number of questions that we want to get to. Harvey, you can join us as well if you'd like. Also, I want to let people know that this is being recorded and we will be sending out a PowerPoint that you're seeing so that you have the information. We'll also be putting it on our website at www.nyaprs.org. First question, which is really kind of going to the point of, are we running out of money here? We have an agency that was trying to apply for a paycheck protection program, and they went to their lender and they were told they were not taking applications any longer. Does that mean that the program's closed, or do they need to go to a different bank, or how does that work?
Well, I see a lot of local banks are pausing. They're saying they're pausing the application intake process right now, and I think it's a lot of it is they're getting to that cap on what the funds are right now, and I think they need to catch up and process all the loans that they currently have. I know we talked about having that fourth bill hopefully being passed with Congress, and once I did get an email today from an M&T banker saying as soon they've also suspended and paused their online application intake, but will reopen it once the fourth bill is passed at that time. So I think it's getting to the cap.
Okay. And is it possible to get reimbursed for hazard pay? Agencies are giving to put staff out who are like doing crisis services?
Well, I would say that should be included in the calculation. So I would say, yes, you should be able to utilize that for hazard pay.
I would just add to what Jessica said that the amount of the funds is based on payroll, right, from previously. So right. You know, you might consider whether or not that amount enables you to pay hazard pay above and beyond what your normal payroll is.
Right.
Yeah, good point. Can the Paycheck Protection or HHA's Provider Relief Fund be used by OASIS, which is our New York State substance use organization, or the Department of Health and Mental Health funded programs in New York City?
So I can speak to the Provider Relief Fund. Maybe I'll bump the Paycheck Protection question to you, Jessica, but those payments are going out automatically. So for the first round of payments went out to providers that are Medicare billing providers based on the share of Medicare fee-for-service billing they had in 2019. So if to the extent that those programs are billing Medicare in any way, they might have already seen a small payment. In addition, CMS is looking at how to make sure that the remaining $70 billion can go out to publicly funded programs, Medicaid paid programs, and so on and so forth. So I think there's potential opportunity there. We just don't have details yet.
Okay.
And as far as the PPP loan for those, and you are able to use it. But again, it's not to replace the grant funding. Really, the PPP is to just help supplement any cost above and beyond any grant funding that covers payroll.
Now, if your organization, this is a great question, by the way, if your organization employer numbers sort of change during the year, so for example, if it goes in the summer goes up to 800, but from September to June, it's below 500. Does that organization still qualify for an SBA loan?
That is a good question, and I know they have guidelines on seasonal businesses. That's what it sounds like it could be, maybe with the fluctuation in employees, but there's certain guidelines, and I can do some more research on the seasonal employers if they go over that cap of the 500 at a certain point, if they would still qualify.
Great. By the way, folks, we're also going to be sending out answers to these questions that we're having some problems answering. So be on the lookout for that as well.
Yep.
Okay, if your employees apply and receive unemployment benefits, including the PUV, what does that do to the amount the employer receives from the PPP?
Well, keep in mind, the PPP is to keep your employees off of unemployment. You can't do both. So if they're going to collect unemployment, you know, you have to, I guess, calculate or think about, you know, your staff, if it's like a restaurant business and they're all collecting unemployment, do you bring them all back? So they should be, if you're going to do the PPP loan, you need to then pay that employee. You can't have it either or.
Now, another question, as you guys have answered some of these along the way here. Another question is, I heard the tax credit for PSL and the PPP loan cannot be used at the same time. Is it true?
The tax, I'm sorry, repeat that question, Lynn. Was it the tax credit?
I heard, yeah, the tax credit for the PSL and the PP loan cannot be used at the same time.
I'll have to look into that one. I'm not 100% sure on that, if something's changed.
And what are there grants or loans available for behavioral health organizations, nonprofits specifically, with more than 500 employees?
So this is something that is potentially in the works. There is, let's see, I believe that there is a lending program authorized for organizations with 500 to 10,000 employees. I don't think it has started making loans yet, but I need to check in on that and confirm. It's something from the National Council perspective that we are acutely aware of. Many member organizations throughout the country with more than 500 employees that need this kind of support. And so we are pushing hard for additional support for these mid-sized employers in the next package. But I'll get back to you with more details on what might already be available. But again, I think they haven't started lending yet.
Okay. Are 1099 employees included in that count?
Yes, you are able to include your 1099 employees in your calculation.
And is workman's compensation included in the PPP or any of the other funding opportunities?
No workers' comp insurance or disability insurance. It's strictly just your state unemployment, and then just the wages and health insurance, dental and vision.
Would we bring back furloughed people and pay them if there isn't work yet, or leave them on unemployment until work is available?
You would bring them back on your payroll, even for furloughed employees.
Another question: if you have laid off people and already, if you've laid off people already and have not received approval for the loan, how will this be taken into consideration in terms of the forgiveness?
Well, they want you to bring them back. So if you're waiting on approval and if they're collecting unemployment currently, then you would still take them back, and then they would just stop and discontinue the unemployment.
Okay. Got a couple more here. Sorry, I'm going through. We got a lot of questions here, folks. Is the grant for telehealth equipment, does it cover HCBS Medicaid services also?
I think that's a question for Rebecca.
I need to check on that. I don't think it specified what you are using the telehealth equipment for. Right, I think it's just you have to meet the category of eligibility, and then you can. But let me check on that.
Okay, thank you, Rebecca.
Mm-hmm.
If we wanted to expand our substance use preventative efforts within our county, how can we go about applying for some of this money? We are currently funded through the New York OASIS, which is the Office of Alcohol and Substance Abuse for New York State. But if we had more money, we could actually expand services to help deal with the crisis.
I mean, I think some of that is going to depend on how your state is allocating some of the funding that comes to it from SAMHSA. It's pretty clear from other grant programs that are available that the funding is available to support response to the pandemic. So I guess to the degree you can make the case that this kind of service expansion is in response to the pandemic, funding may be available, but otherwise we're not seeing a lot of like brand new funding flowing from the feds for service expansion. It's more about keeping providers afloat.
Yeah. Here looks like we might have an answer to the furloughed employee question. Thought you had until June 30th to bring back furloughed employees and still not have to return that portion to loan.
That is true. I think that in order to maintain your full-time employee calculation, you do have up until June 30th. So I guess depending on when you decide to bring them back, you would need to maintain, I think that's 75% of your staff.
Okay. Another question, if government is covering some personal costs, can you still apply to PPP for those costs, or is it considered a grant and you would have to pay back those costs if already covered?
What was that? I'm sorry, you broke up a little bit.
Oh, sorry about that. If government is covering some personal costs, can you still apply to PPP for those costs, or is that considered a grant and you would have to pay back those costs if already covered?
Well, if the funding is a grant, you want to still utilize that first. So, which would cover some of your personal costs. If there's any kind of admin expenses for payroll that aren't covered under that grant, then you could use the PPP to cover that difference. But you still want to be able to utilize your grant first. If in the loan calculation, you're going to probably definitely go above and beyond what you're going to need. At that point, after the 8-week period, you can pay that back. So there's not, or keep it as a loan, but it won't be forgiven. Because you don't want to lose your grant.
Can the FCC funding be used to purchase devices for persons receiving services?
I am not sure. These are great questions. Let me,
know, aren't they?
yeah, they're really good. Let me add that to my list and follow up with you.
Okay. Folks, it is a little after 1, and we've only got a couple more questions, so I'd like to push on and answer as many of these questions as we possibly can. So another question is, so what if the services are fee for service and not a grant? Does that matter?
It might help to get a little more detail from the person who asked this question. Is this in the context of what funding initiative?
Maureen, can you give us a little more information on that while we answer another question? And another question, for PPP, is this available to local government entities, community mental health service programs that are funded through Michigan Medicaid capitation program?
Yes, it should be. As long as you're a 501(c) nonprofit entity, you're eligible.
Okay. Just looking for another question here. So, how does this affect the ACT or face-to-face providers?
Well, I think there's a lot of, I think there's a lot of considerations there, right? And there's many ways that providers are adapting delivery of models like ACT to try and accommodate social distancing. National Council is hosting office hours on a variety of topics related to delivery of services. Maybe this is one where we can share with you, Len, what those office hours are and when they're coming up, and folks can, can join to have those kinds of discussions.
Okay. Maureen's question, which was the question about fee-for-service and not grant, like clinicians who are billing versus state aid grant-funded staff.
So I think, is the question, it seems like this question is in the context of the Paycheck Protection Program, if I'm understanding it correctly.
Yes.
Yeah, that's what it sounds like too.
So the question being, what kind of support is available for you from PPP if you are participating under different models of how you bill services and pay employees? Okay,
so for fee for services, because it's the way that you bill versus their salary employees. That, I guess, depending on the payroll and how, if you're paying an employee in 2019 per se, and you're really going to just look at the 941 on a quarterly basis. So you're able to still calculate the salary for that person. I understand it probably varies if it's fee for services for what it's currently being billed at, but I would say that you're still able to qualify for that. The amount will just change of what you're actually paying versus being just a salaried employee.
The other, Maureen is asked, Jessica, that you commented and use your grant first, trying to look at the other side of the coin.
Yep. So that's really the rule of thumb. And I spoke with a couple of different auditors in our area, John Bryan's being one of them, Len, and they agreed that you for nonprofits, you really want to make sure you utilize your grant first.
Another question, final question, actually. Important to be clear, well, actually, one just came in. So, important to be clear that the relationships between grants that cover your personal expenses and the PPP, if your grant is covering your payroll, should you be applying for PPP?
You still can, yes, as long as if you have payroll expenses that are not covered under your grant, if you're fully covered under your grant, then it probably makes sense not to. I don't know if that's the case, for this particular one, but if you're fully covered under that grant, then I wouldn't recommend it.
And we have another question. Recently lost funding for 2.5 clinician positions in our OASIS license program, and we'll need them, have to lay them off by 5/31 because of the, the funding ran out. Can Paycheck Protection or HHS fund be used to keep those individuals employed during this time?
Yes. Yes.
Finally, just wanted to echo the question John asked in regards to telehealth services being extended, supported after the current crisis is resolved. And this is specific to HCBS services.
So one of the things that we are working on at National Council is to try and make these changes permanent beyond the end of the emergency. I think we're going to see a really important explosion in access to care through via telehealth, and we need to make sure we don't backslide at the end of the pandemic. So although most of these changes are in effect for only the duration of the emergency, we are submitting comments to CMS. We're engaged in conversations in both, in Congress and with the agency to try and lay the groundwork for beginning to talk about making these permanent after the emergency ends.
Great. Well, we've come to the end of our hour, and actually an hour and 10 minutes. And I want to thank everybody, specifically Rebecca Farley-David and Jessica Johnston for your time today. If we were not able to answer your question and we indicated that we're going to get back to you, we will indeed do that. I also want to remind folks of another webinar coming up on April 23rd from noon to 1. And that is entitled Building Hope, What CARES Economic Stimulus Payments Offer SSA Recipients. So I'm hoping that you'll join me for that as well. We will be sending out the PowerPoint and the recording. And Harvey, I'm going to have you say the last words.
Well, again, Len, thank you for hosting this webinar and having such great speakers. Thank you, Jessica. And as always, thank you, Rebecca. I think if there are remaining questions, they can email them to you, Len. Does that work?
That would be fine.
So that would be lens@nyaprs.org. That's LENS@NYAPRS. And as Len said, there's more to come. This is just the beginning of a long series. And I want to also remind you that we have an executive seminar program that we have transferred to be virtually half-day programs in the coming few Tuesdays. Keep an eye for them. They're really very strong programs and they're free. We really have some excellent speakers and presentations, and we wanted them to offer them as a gift to you all for the courage and commitment you're all showing out there. So, stay strong and safe, and hopefully we'll see you next week for the webinar on Thursday.
Thank you.
Bye-bye, everybody.
Bye, everybody.
Bye-bye.